Good evening and welcome to Health Check. Now, arthritis is the swelling and tenderness of one or more joints. It causes pain, aching, swelling, and stiffness of the joints. The most common type of arthritis is osteoarthritis and rheumatoid arthritis. I had to say that slowly. Now, on Health Check tonight, the conversation is on arthritis, and to help us along with the same discussion is Professor Omondi Oyoo. He is a rheumatologist and the head of rheumatology unit at the Kenyatta National Hospital. He's here and ready to answer all your questions regarding arthritis, which you can start sending them in. Our SMS number is 22232, that is 22232. You can also watch us live. You're live on Facebook and YouTube. Our handle is at Hope TV Kenya. That is at Hope TV Kenya. You can drop there your question and your comment, and we'll be glad to reach out to you. Good evening again. My name is Grace Mutiso, and welcome to these editions of Health Check on Hope TV Look and Live. At this point, allow me to introduce to us Professor Omondi Oyoo, a rheumatologist. Good evening, Professor.
Good evening.
You're doing well?
I'm very well.
And had a beautiful day?
Yes, you can say so.
Okay, so let's begin this interesting discussion by just trying to understand who is a rheumatologist and what does a rheumatologist treat?
A rheumatologist is a medical specialist who specializes in conditions that affect the bones, the muscles, and the connective tissues, and sometimes the blood system. So he treats those conditions that affect the bones and the joints and muscles and connective tissues. Diseases you have heard of, diseases like arthritis, lupus, yes, some muscle diseases, and a variety of connective tissue diseases. And you know these conditions affect all parts of the body. Yes. So a rheumatologist, so to speak, is a total doctor. Yes.
A total doctor.
Total.
I hear you, Professor.
Yes.
Okay. And you know, we're just having this discussion, you know, on the eve of World Arthritis Day, which is celebrated every 12th of October annually. And we'll be getting to talk more about this before we wrap up the program. But I would like us to begin our discussion by helping us define what is arthritis, you know, and what causes it.
No, arthritis is it's not a disease as such. It's a description of a situation in a joint, a description that there's a problem in the joint. The joint is screaming to the patient, yes, that there's pain and swelling of the joint, and that is what we call arthritis. And you can have aches and pains in the joint without swelling. We call it rheumatism. So there are over 200 situations which can cause pain and painful joints. And each one of them is caused by a variety of things. But on top of the list, we have 5 or so common forms of causes of painful swelling of the joint. So you cannot say what causes arthritis. Yes. What causes this specific arthritis. So when you have pain and swelling of the joint, it is important that you seek medical attention so that the cause of your pain and swelling of the joint can be defined. But the commonest form of arthritis is called osteoarthritis. Yes. Osteoarthritis is pain and painful joints arising from degeneration of the joints, of the cartilage of the joints. And it is the commonest form of joint pain and swelling. And it affects, it increases in prevalence as you grow older, because the more it comes because of overuse of the joint, or trauma to the joint, or a previous infection to the joint. And this is commoner in the older folks. Yes. But it can start early. For example, if you are young and you get an infection of the joint, you can also get osteoarthritis, which is a damage to the cartilage, and is the commonest. The second commoner osteoarthritis worldwide is rheumatoid arthritis. And rheumatoid arthritis occurs because you have antibodies in your system. It is an autoimmune. It is your immunity which is fighting. Antibodies are fighting in your system, and they form some complexes which come into the joint. And when you are trying, your body is trying to clear these complexes, you get an inflammation in the joint. Yes. And this is painful swelling of the joint arising from this process of autoimmune. It starts from somewhere in the genes. Mm-hmm. People think that there could be some infective process that starts it, but those are not yet proven. But you must have some genetic kind of orientation that makes you have this condition, rheumatoid arthritis. Mm-hmm. Commoner in women than men, the ratio is 3-to-1 worldwide. Yes. But we keep on getting conflicting figures. But we have not done a population study. Yes. Because, when you do it in the hospital, obviously you'll get more women, because women are the ones who like coming to the hospitals. Yes. In our setting. So you will get ratios of 5-to-1 or 6-to-1, even 9-to-1. But worldwide, the ratio is for every 3 women, there's 1 man affected by rheumatoid arthritis. Okay. The difference here is that, osteoarthritis, the commonest joint it affects is the knee joint, yes, followed by probably the hip joint, the hands, and many of the issues of back pain called spondyloarthritis are just osteoarthritic processes. Mm-hmm. But this one affects mainly the small hands, the small joints of the hands.
Like around here.
Yes, these were the fingers, the knuckles here, the feet. And if the right one is affected, the left one will be affected. So it is symmetrical. Yes. But osteoarthritis can just come on one knee. And that's it. So this one is a symmetrical arthritis, inflamed. You get stiffness of the joints in the morning. You wake up in the morning, you cannot even step down. But after 1 hour, you are able to manage with that. But once you get this inflammation repeatedly and damage of the joint, you also end up with osteoarthritis. Okay. So osteoarthritis is the end product of any form of arthritis, because the joint is heading towards failing. Okay. Then the other arthritis, which is very common, is gout. In fact, worldwide, in terms of those inflammatory arthritis, yes, gout is the most rapidly increasing. In fact, it's becoming an epidemic worldwide. But gout arises because your body has got high uric acid levels. And when they reach a certain level, high level, over 6 milligrams per deciliter, they form crystals. And these crystals are deposited in the joints. When the body now is trying to remove these crystals, you end up with severe inflammation. And this one is commoner in men. Around 40 years. It is the commonest inflammatory arthritis in men. And it's one of the most painful conditions that a man will experience in his life. Women have got other painful conditions that they experience in a monthly or once in a while, every so often when they're getting birth. But men, this is the most painful. And it is increasing worldwide. Even in Kenya, it is increasing.
Yes. Why?
Because of the lifestyle. Number one, people are leading a sedentary lifestyle. Yes. Number two, the diet, the kind of diet that we are eating. In the past, it used to be said that it is the disease of kings, that you have to get involved in overconsumption of good food, good wine, and so forth. Yes. Then you end up with gout. But it was described disease of kings. But it was also the king of diseases, because it used to put kings down. Yes. Even if you are the strongest king, when you get gout, you will be grounded by the pain that you experience. So because of this diet and lifestyle, we have seen a decrease in the age of onset. We used to say in the 40s, but now we are seeing even 20s.
Oh, really?
Because you see many obese people in teenage. You see within the 20s, people are just taking alcohol excessively. People who are taking a lot of animal proteins, and so forth. And these have got consequences. The choice of your diet have got consequences to your health. In fact, when you're talking about diet,
Yes.
when you eat food, you are making an important decision concerning your life.
Yes.
Even how long you'll stay in this world and the quality of your life depends not on your wealth or insurance policy, on the food that you are eating.
Yes.
And you will be grounded by gout, diabetes, hypertension,
Yes.
just because of the choice that you make when you are eating.
Okay.
So gout is a consequence of choice. But that one, also we see there's a drive. Because you can have two people going to Kenyatta Market here
Yes.
and eating each one of them 1 kilogram of meat. And it's not a joke. They eat quite huge chunks. But one will get gout, another will not get. Because there's also a genetic predisposition to gout. And women also get it after menopause. Because when you are still in the reproductive age, you get protected by the estrogen. Estrogen is protective towards development of gout.
Okay.
So women are protected in that sense. That's why it is much more commoner. But above menopause, it is commoner in women. And the reason why I must mention it is because it is not identified. Nobody thinks that a woman will get gout. So when you meet one with the gout, you just start thinking, oh, it's osteoarthritis, it's both of the finger, and so forth. And you see, gout also tends to go to those joints which are already damaged.
Yes.
So a woman comes with her finger, which used to have osteoarthritis, with severe pain, not responding to the common medications. And you end up, if you don't think about it, the woman will be having gout, which will miss, and the woman will be suffering excruciating pain.
Okay.
Yeah, so that's the third commonest and worldwide, but it is rapidly rising.
Yes.
Because because of our lifestyle.
Okay.
Yes.
I'm hosting Professor Omondi Oyoo, a rheumatologist, and we're talking about arthritis. If you have any question, in regards to today's topic, our SMS line is 22232. That is 22232. You can also get us live. We're live, by the way, on Facebook and YouTube. Remember to share this content with a friend, with a family member, a neighbor, in those WhatsApp group. Somebody can benefit from it, and you can drop there your question on the comment section. We'll be getting a look at them before we wrap up the program. So, Professor Oyoo, one thing I'm picking is arthritis is majorly a joint condition.
Joints
From beginning to end.
And everybody has joints.
Oh, yes.
So it can affect everybody.
Yes.
So that leads me to the other form of arthritis.
Tell me.
The reactive arthritis.
Which one is that?
Reactive arthritis is arthritis which comes as a result of some infection, either in the urinary tract or in the intestinal system. You are affected by certain bacteria or organisms like chlamydia. And when this organism is deposited, part of the organism is deposited in the joints, the body reads it as foreign and starts fighting the joint. And then the joint reacts by pain and swelling. And you could have other conditions like eyes being involved, or the feet, or the genital area. It can start with diarrhea or something which looks like urinary tract infection, and you end up with arthritis. Yeah, it is. That's a form of arthritis. Then you have other forms of arthritis we call spondyloarthritis or seronegative arthritis, which mainly affect the large joints and the back. And these are also genetically, there are about 4 or 5 of them. There's one we call ankylosing spondylitis, which comes with severe back pain, eye problems, and some genital problems can affect even the heart and the lungs in some way. Yes. And it is also a form of arthritis. And then we have enteropathic, where you have a problem with the intestine, but you start with diarrhea or irritable bowel, then you end up with arthritis of the joints. And that is another arthritis which needs to be there. They are also very common. The commonest cause of back pain in young people are this so-called spondyloarthritis. So if you meet a young person with back pain, you must look for, you must try to establish, is this person having a spondyloarthritis? And because it's inflammatory and is easily manageable than the other mechanical causes of arthritis. Then one of the other things that happens is that the trauma that we have in the environment, injuries, sports injuries, road injuries, violence and all that, also end up causing traumatic arthritis. And then the infections, infections are common in tropical countries. TB, other bacterial infections can affect the joint and end up with arthritis. Then the big issue is, does arthritis affect children? People don't think that it affects them. We have specific forms of arthritis that affect children, and we call them juvenile idiopathic arthritis, about 7 of them.
Yes.
And they can affect the children, like rheumatoid arthritis, where you have pain and swelling of the joints, both sides. The test could be the same. The rheumatoid factor can be positive, like in adults. Then you can have those ones which affect just a few, 3 or 4 joints in children. Yes. And they can have the one which affects all the joints, with all the systems, with fever. You can have that. And again, trauma and falls are very common in children.
Yes.
Trauma, child abuse, a child is limping from school, maybe being kicked all the time by colleagues, or being battered at home by a parent or other people who care, other caregivers. So you see, the child can come with arthritis, and you need out to walk around, navigate around this child until you get what is it that is causing this painful joint.
Yeah.
Yes.
It's sad to hear in children, I'm just wondering, the little bundle of joy keeps crying and you're wondering, what happened? Kumbe, something happened. And so how can you be able to tell? Because I know you have so many parents watching, especially on the young ones who are not able to talk, but at times they climb and they fall, and you've mentioned trauma as part of it.
Even infections, by careful observation and questioning the child, if the child can talk, yes, you are able to pick up. Pediatricians and pediatric rheumatologists are experts in this. But sometimes a child, if you are being terrorized by the school teacher or by a house girl, sometimes you may not want to speak. So, but you carefully evaluating the system. Sometimes it even requires psychological counseling before you're able to get to know what is it that is happening in the life of this child.
Okay.
Yeah.
Aye. Thank you. Really, broadened it and helped us understand the different types of it. So I wanted to ask, is it hereditary?
Yes and no. Yes, in the sense that, I've said that rheumatoid arthritis, there's a gene. And there's some genes which are commonly found in these patients. And if, for example, you have arthritis, and you are twins, identical twins,
yes,
the chances of the other one having arthritis is like 25%. But if you are first-degree relatives or of non-identical twins, it's about 10% in comparison to the general population. So it means that if you have arthritis, your chances of having arthritis or your chance of your sibling or your offspring having arthritis is higher than the general population. But it is not 100% transmissible that if I have arthritis, my child is going to have arthritis. It's not like that. So, things like rheumatoid arthritis, gout, they are the chances, if you, for example, gout, if you have the same lifestyle and all that, you are going to get arthritis. And we have observed that it is getting younger. The other cause of joint pains, which is commoner, is lupus. Lupus also starts with arthritis. Before it manifests with the skin and blood and all that, it starts typically just like rheumatoid arthritis. But it evolves to become different with careful observation, evaluation, and testing, the outcome, the whatever it manifests are different. But it also has arthritis as a manifestation, as a beginning. So yes, the answer is that especially these inflammatory forms of arthritis are inherited. Even some forms of osteoarthritis run, especially this one which affects the hands, the distal interphalangeal joint of the hand. We call it nodal osteoarthritis. It's fairly genetic, in origin. That if your mother has it, you're likely to have it at some point. If you live long enough to be the age at which your mother is at that point.
And is there anything that, this young person who knows either had a parent who suffered from it can do to avoid getting it?
Yeah, there's some things which are avoidable. For example, if you talk about osteoarthritis, it has been found that if you're obese at an early age, obesity as it were,
yes,
you are predisposed to knee and hip arthritis, or even arthritis of the hands in old age. So if we can avoid obesity, we will be postponing arthritis. Obesity as it were, tackling obesity is a very important aspect in managing many of the health conditions. Because if you can reduce obesity,
yes,
you'll be able to reduce arthritis, you'll be able to reduce diabetes, you'll be able to reduce hypertension,
yes,
even cancers.
true.
You get it?
Yes.
So obesity is if there's one thing that we need to deal with in a decisive manner, is to deal with obesity. Then, secondly, even if you have gotten osteoarthritis and you reduce your weight by 10%, you'll reduce the pain of the knee by 50%. So you will gain health by losing weight.
Yes.
You lose something, but you gain something.
Yeah.
So that is possible. Secondly, is to, when we think about inflammatory arthritis, inflammation times time, inflammation allowed to go on for a long time is equal to joint damage. So you need to seek medical attention early so that the treatment is done early so that your joint is not damaged.
Yes.
So when you get pain and painful joint, you should seek medical attention as soon as possible so that you are a diagnosis is made and the inflammatory process is halted as soon as possible so that it doesn't continue for a long time. So you can do something about it. Your future is actually in your hands. In fact, the theme for this year's World Arthritis Day is that it is in your hands.
Yes.
Yes. Yeah.
And for sure it's in our hands because of health,
yes,
and the diet, weight and diet.
And even the choice to go and seek competent medical attention.
Yes.
Yes. Oh. When you have arthritis and you choose to go for unproven remedies and other things that are always in the lay press, Facebook and so forth and all that, things with wild claims,
yes, you
will just be putting yourself in a harmful situation. Yes.
I hear you, Professor. I'm hosting Professor Omondi. You're a rheumatologist, and you're talking about arthritis. Do you have any questions or comments? SMS us on 22232. That is 22232. You can also get us at Hope TV Kenya. Those are the platforms you can interact with us, and we'll be getting to your question. Professor Oyoo, you mentioned that arthritis, let me use the example you said of men. You wake up, you can't even stand, and the pain is too much. And somebody could be experiencing that and say, hey, I think I have it. So how do we diagnose arthritis?
Yes, a diagnosis of arthritis is a skill that we teach in the medical school. And for you to make a diagnosis, you have to profile the patient. What is the gender of the patient? What is the age of the patient? So you take a history from the patient, yes, and you examine the patient. There are those arthritis which are commoner. If somebody comes, for example, a young lady of 20 years, you already know that this one is likely to have rheumatoid arthritis or lupus, those ones.
Yes.
And then you look at the patterns, of the arthritis, and then you decide. You do some tests.
Yes.
For example, if you get rheumatoid arthritis, it is going to be a young person in the second or second or third decade of life, and it's going to be symmetrical, and the joints, it affects both the joints. And therefore, once we confirm that one, we do some tests, and the common test we do a rheumatoid factor, anti-CCP, and even in the blood itself, you see anemia and markers of inflammation are increased, and there's a scoring pattern. Yes. Fortunately, in this country, we have a guideline which has been published, guidelines for diagnosis and treatment of rheumatoid arthritis, which has been published by the Arthritis Society of Kenya, or Rheumatologist Society of Kenya, has produced guidelines to be used by health workers in the country, and it's available for free. Even in our website, it's available for free for use in the country to make diagnosis of rheumatoid arthritis. But gout, for example, you meet a man in his 40s, and based on his lifestyle and a genetic profile and the distribution of the joint involved, you can make a diagnosis of gout. And when you do the uric acid levels, you find that the person has got high uric acid levels, and then you say, this is gout. Yes.
Okay, thank you. Allow us to have this quick break. When you come back, we'll still be having Professor Omondi Oyoo with us, focusing on arthritis, and also we'll be sampling some of your questions and comments. And of course, we'll be talking about World Arthritis Day that will be happening tomorrow. Stand by for that. Right now, keep it at Hope TV. Look and live. This is Health Check. My name is Grace Mutiso. Don't go too far.
Hope TV is now available on Go TV channel 103, Zuku channel 873, Signet channel 817, and Star Times channel 026. Enjoy our uplifting content and family-friendly programming anytime. Hope TV, you look and live. Every Wednesday at 7:30 p.m. Spotlight.
Do you feel like they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking.
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live. The RAF is a chance to showcase your talent in music, dance, poetry, acrobatics, and more, and stand a chance to win 500,000 shillings, a recording deal at Hope Recording Studios, and many more prizes. The RAF is a space for talented youth between the ages of 18 and 24 years. Auditions in Mombasa will be on Thursday, the 13th of October 2022 at City Mombasa, and transport to the venue will be provided from Nyali Cinemax and Technical University of Mombasa at 7 a.m., 8 a.m., 9 a.m., 10 a.m., 11 a.m. and noon. To register, send an SMS starting with hashtag #TheRAF with your name, county, and talent to 22232 to get an invite to auditions happening near you. For more information, please call 0709 861 223. Remember to carry a copy of your national ID to the auditions. The RAF, identifying talent, inspiring passion.
Welcome back to Health Check on Hope TV. Look and Live. My name is Grace Mutiso. I'm hosting Professor Omondi Oyoo, a rheumatologist, as we talk about arthritis. And in a short while, we'll be sampling some of your questions. Our SMS line is 22232, and it's at the bottom of your screen, I believe. You can get that number right there, 22232. Yeah. 22232. That's the number. You can interact with us. And if you're watching us on Facebook and YouTube, the handle is at Hope TV Kenya. You can drop there your question. We'll be getting back to you in a short while. Okay. So, Professor Omondi, what are some of the common symptoms of arthritis?
Arthritis is the commonest symptom is pain of the joint, sometimes swelling of the joints, reduced function of the joint, and inability to use the limb where the joint is occurring. Yeah. In fact, musculoskeletal disorders as a group is the commonest cause of pain and the leading cause of absenteeism from work and the leading cause of retirement. And retirement, musculoskeletal disease as a group, and affects over 10% of the population. It's one of the most serious conditions that you can talk about in health and least talked about. Yeah. So it's one of those things when they come to you, you cannot, if you get back pain and you cannot go to work, you will not go to work. True. And you see, like back pain, is in the worldwide, is the leading cause of years lived with disability. True. The leading cause. And is the leading cause of early retirement. So we are talking about something very, very significant in the population. Yeah, and one of our concerns is the fact that it is not taken care of very seriously, including by governments worldwide. And that's why we keep on talking. And that's why we have the World Arthritis Day. Yes.
Let's talk about World Arthritis Day. So what's the focus on? And as Grace, mwananchi wa kawaida, what do I need to know about World Arthritis Day that will be happening tomorrow?
So the focus, World Arthritis Day was started being celebrated from 1996. And since then, we have been having World Arthritis Day every month, yes. every 12th of October. And the focus is on understanding the issues diverse audiences have in the field of rheumatology. You see, the issues that we have, number one, is the shrinking medical workforce, the inadequate medical workforce to deal with musculoskeletal diseases. That's one of the focus. Then the long waiting times for appointments because of the shrinking
workforce.
Yes. And then lack of understanding of the rheumatic diseases among governments and governmental decision makers. They don't take it seriously. So the theme this year is that it is in your hands. Take action. So who is supposed to take action? People with arthritis should take action.
How?
Take action by seeking medical attention and by demanding for medical resources. Yes. For example, now we have just had elections of governors, and they are going to have public participation when they are allocating resources. Yes. So when they are allocating resources, people with rheumatic disease must also sit there and say, what is your budget for arthritis and rehabilitation? Yes. Is there a physiotherapy unit in this county or in this sub-county? Yes. Is there a health facility where you can seek medical attention within a walking distance? Is there a rheumatologist in your county? Is there a physiotherapist in your county? Is there a physician who can manage arthritis in your county? What is their plan? Yes. And these are the things. Are there medications So people with arthritis can take action and demand for legislation. For example, are the buildings in the county user-friendly for people with disability? Do they have ramps? Are the buses in your county having ramps where you can ride in with a wheelchair? You know, those are people with arthritis can take those actions.
Yes.
Secondly, the caregivers themselves can take action. Caregivers are the ones who manage patients with arthritis.
Yes.
If you go to a hospital and you are seeing patients with arthritis and there's no medication, you must sit. There's no medication, there's no testing facilities. You must take it in your hands to go and demand for those who are managing that hospital to provide resources for you to manage patients with arthritis.
Yes.
Then families can also take it in their hands. We are believing that families should also demand and avail resources for people with arthritis. For example, one of the things which are difficult in this patient is, one of the difficult things for this patient to manage are resources for lab testing and for drugs. And for example, we are talking about universal health care.
Yes.
We hope that everybody in this country will register and join NHIF. All will be registered by the families. Families can pay for NHIF 6,000 per year, so that NHIF covers everybody. And then these diseases will be covered by NHIF. And the families can take action to make sure that everybody in the family is registered.
Yes.
And then within the general public will take action by demanding that health, this arthritis is covered by NHIF, all aspects of it, based from diagnostic, medications, and rehabilitation. Then people also can take action to improve their lifestyle, reduce weight, eat properly, stop excessive consumption of meat, alcohol, and exercise, and make sure that you are able to have a good health. And then people with rheumatic disease join together to make their voices heard. Make their voices heard. And this is possible. You know, for example, dialysis for patients with renal condition was not brought because the government lives them. No, they make their voices heard. The free treatment for people with HIV did not come because they are no, they came together as patients and they got free treatment for antiretroviral drugs. And this is also possible. These musculoskeletal conditions are commoner than HIV and commoner than any other condition that you think about. Apart from the common cold, upper respiratory tract infection, this is the commonest conditions. And people can come together. But together, we can spread awareness about this existence and impact of musculoskeletal diseases. And that's why I allowed your channel for spreading the awareness and the impact. And this is what you can do as the media to keep on spreading the impact. So this thing is in our hands. Everybody, the policy makers can bring it in their hands. You know, last year, the nominated senator, Honorable Mwaura, brought it in the Senate about the treatment of these conditions. And there was something being worked out. It has not been realized on the ground, like NHIF covering people and so forth. But we hope that with this, our voices will be heard.
Yes. And I know there are so many leaders watching us right now on Facebook, YouTube, and also on Hope TV. Please do something. And you are common mwananchi like me. You've said it's in our hands. We need to do something. Come together, speak about it until something is done. So allow me to sample a question that has come through. One of the listeners is asking, Daktari, what are warts related to arthritis? Warts. W-A-R-T-S. Is it related to arthritis? And is it safe to deliver normal if warts is in your genital areas during pregnancy? I'm not sure if it's related.
Most are not related. I think that's a totally different condition.
Yes.
And whether it is safe to deliver or not, but normally, once you are, when you are due to deliver, you'll deliver whether you have warts or not.
Yeah.
But now the gynecologist will decide whether you are going to deliver by cesarean section or anyhow. But I think that is, to answer the question, they are not related to arthritis. But I'm sure you'll bring a gynecologist here soon.
Yes,
to talk about warts and delivery.
Yes.
Yeah, I'm not competent to delve into that in details.
Okay, Professor. But we've talked about, since she's an expectant, she's asking about expectant mothers, and you've mentioned this disease condition affects the joints. So if an expectant mother is diagnosed with arthritis, is that pregnancy at risk? Or how, and another question is, how should they take care of themselves if you're diagnosed with arthritis?
Usually we have arthritis, rheumatoid arthritis affects, even lupus, affects mothers in the child delivery age. So the mothers can also be affected by arthritis. But the good news about rheumatoid arthritis is that the hormonal composition of the mother during pregnancy favors rheumatoid arthritis in the sense that now the symptoms tend to ameliorate, tend to go down. So even if you are taking drugs, they go down. But also careful to know which drugs are safe in pregnancy and in childbearing. So the mothers with rheumatoid arthritis can safely get pregnant and deliver. But immediately after delivery, a week or two, the symptoms can come very ferociously, and you need to see a doctor as soon as possible so that you are able to take care of your baby, because the joints can be such that you are not able even to hold your baby. But lupus, for example, or all these arthritis, we try to want the mother to be under control before conception. We say that the pregnancy must both be planned for and wanted. You don't just come, oops, I'm pregnant. Because there are some medications which we don't want you to be taking when you're pregnant. So once you have rheumatoid arthritis, you should plan for your pregnancy. And also, you must want to be pregnant and plan so that we can also give us time to change your medications, and give you those which are safe. But again, if you're not well controlled, especially with lupus, you will get also all manners of complications, ranging from disease getting active, hypertension, eclampsia, low child abortions or infant death, the child dying in intrauterine fetal death, or all complications of pregnancy can occur in a patient with lupus if your lupus is not well controlled, and can also affect your baby. Yes.
What I'm hearing you say, Professor, is you literally, if you're planning to get a baby and you've been diagnosed with arthritis, you must work with the doctor.
Yeah.
Plan for it.
You have to plan for it, for successful outcome.
Okay.
Yes, because one of the most painful things is to be pregnant and then you don't get a successful baby.
True.
Yeah, it's very traumatic.
Very.
Yes.
Okay.
Yeah.
I knew you mentioned about juvenile arthritis before, but now because you're talking about expectant mother, so is this juvenile arthritis, is it diagnosed at birth, or the child has to live a bit before you diagnose it?
The one which you can come with at birth is congenital lupus. But juvenile arthritis starts around second year, third year, fourth year of a child. Up to, in children, in Kenya here, we are talking about people of age from 0 up to about 15, 18 years.
Yes.
We still call them children.
Yes.
But above that is an adult. In European countries, a child is even up to 20 years because, there's shortage of children, so you must create. But here we are even fighting for the age to be reduced because the number of children is huge. Yeah, but so it can come from age of 2 years or upwards, and there are various forms of arthritis. And the most, they can be very bad. They can be very ferocious. What we try to do is to make sure that this child joints are preserved and does not go to a wheelchair. You want to prevent that one. And that's why they have to be treated early and aggressively.
Okay. Let's get to the treatment of both the child and the adult who has arthritis. How is the treatment done?
The treatment, it depends on the type of arthritis. But the most important thing is to control pain. Because the reason why the patient comes to you is because of pain. So you have to control the pain, then you have to modify the disease. Because pain is a symptom, but there's a process that is leading to this. When you talk about osteoarthritis, we don't have much in terms of disease modification at the moment, but there's a lot of studies going on. There's some supplements and all that. But you control the pain, you use physical therapy and various forms of rehabilitation and some medication that can reduce the joint damage. If you're talking about rheumatoid arthritis, we have various medications. Apart from pain medications, we have methotrexate, we have hydroxychloroquine, sulfasalazine, leflunomide, and then there are other biologic agents which are expensive but are available even in this country. And this is where we talk about the problem is affordability, and we are hoping that these are some of the things that are reformed NHIF with the universal healthcare will be able to cover. It is pointless to pay for me consultation and leave me alone when it comes to medications. You have not done anything for me. You must walk with me through and we hope that even NHIF will take it in their hands to cover patients properly and completely. Then we have those drugs. But you see, even in children, we use more or less the same drugs. And in children, the arthritis is more aggressive. So we try to be even more aggressive in children in terms of the medications, in terms of dosing, and in terms of usage of these drugs. But all that we need to treat arthritis is available in this country, let me say. What is not available is that, number one, we have paucity of healthcare workers who are trained and skilled in management of musculoskeletal diseases. We have enough occupational therapists and physiotherapists in the country. But the problem is that they are idle because many of the county and sub-county hospitals do not have physiotherapy units. And this is tragic. Physiotherapy units, especially when you are having the aging population, should be the nearest, even right from sub-county health center or something, sub-county hospital.
Yes.
And that should even be more available. But secondly, we are also training skilled medical officers who are leaving the universities, are well trained in early diagnosis and management of rheumatic diseases. The problem that many of them are left unemployed while the hospitals are empty of doctors. And that's another thing that we hope that the government will deal with. We'll have the doctors move them from the streets to the hospitals.
Yes.
It is tragic that our patients don't have doctors and there are doctors walking around looking for jobs. And very soon we will form a task force to discuss this one with the government so that our doctors are removed from the streets into the hospitals.
Yes.
Yeah. Because, Then the other thing, the rheumatologists themselves, in a country of 40 million, we have only 12 rheumatologists, 2 pediatric and about 10 adult rheumatologists.
Across the country?
Across the country. And our desire is that any county referral hospital or at least a teaching and referral hospital should have a rheumatologist. And that's really, there's no, even these rheumatologists who are trained in this country, the government has not paid even a single cent, beginning from myself. We are foreign trained by other governments. It's as if there's no rheumatology in this country. There are no rheumatology diseases in this country. There's no budget for training of rheumatologists.
The government has a lot to do.
Yes.
Yeah.
There's no budget in the Ministry of Health to train rheumatologists.
Yes.
And this is very tragic.
Okay.
And yet we need these specialists in every county hospital.
True.
Or the so-called referral hospital.
Okay.
You cannot refer a patient to a facility where there's nobody to take care of the patient.
I hear you.
Yes.
I hear you, Prof.
A referral system is the people and the services offered there. So why do you refer a patient for a service which is not available because there's no personnel who are trained?
Okay.
Yeah.
We have a lot to do. Serikali, ingilia kati. Mkono wako ni mrefu. Okay. Before we wrap up the program, what are some of the risk factors, that come with arthritis, Daktari?
the risk factors, the risk issues, the risk factors we talked about are genetics, we talked about lifestyle, but what we know is that we try to treat these patients early to avoid the risk of being disabled and dependent. You know, once somebody is disabled, becomes independent. You know, rheumatoid arthritis, once it damages the joint, you now go for even a more expensive intervention of surgery.
Yes.
But although we work as a team, the orthopedic surgeon, the physiotherapist, the occupational therapist, the nutritionist, the rheumatology nurse, and the rheumatologist, we work together as a team and intervene to prevent the patient from being disabled and dependent. Secondly, we like patients to keep working. We want them to keep them working. We don't, you know, very many times I'm called, can you make a comment for this patient to be retired on medical ground and so forth. I do not treat patients so that they retire. I treat them so that they go back to work. To work.
I hear you.
And I would rather the employer finds out what is this, how many hours is this patient able to work. If it is 2 hours, employ him for 2 hours per day. Instead of saying now this one should go home. Going home to do what?
I hear you, Professor.
Yes.
Allow us to sample a few questions. We have 2 minutes, 3 minutes to go. Please tell us a little bit about tuberculosis arthritis. It's becoming very common. One of the listeners is asking.
Musculoskeletal tuberculosis is very common. It is not becoming, but it's very common. It's one of the difficult to diagnose, but it can affect the joints, the spine, and it's very difficult to diagnose and difficult to treat. It's treated longer, for a longer period with than the normal pulmonary tuberculosis. We treat it even up to 2 years. And the diagnosis requires even a biopsy, and there's a scoring system. Yeah, it's one of the ones that are classified under infections.
Okay.
Yes,
okay.
but it's common.
One more says, kindly advise on the best method of prevention. That is Thomas asking. Prevention. How do you prevent arthritis?
If you can prevent gout by watching your diet and your weight. Osteoarthritis by having a safe environment and having ideal body weight. And that one is prevention. But the biggest prevention is to bring services to the people.
Yes.
Bring services to the people so that there's early diagnosis, and then we can prevent disability that is arising from arthritis.
Okay. I'm suffering from arthritis. When I sleep at night, I suffer another pain at the waist. When I am walking, it's not, when I wake, it's not there. Why pain only at night? And 2, do we have blood arthritis? That is Giles from Kericho County.
Yes, arthritis, you know, like, for example, back pain. She's talking about back pain. Inflammatory back pain. The ones we talked about, inflammatory back pain like spondyloarthritis, ankylosing spondylitis, are more common at rest. And when you get a lot of pain when you are lying down, that's a wake-up call that you go and see a doctor. The other degenerative arthritis is normally quiet when you are resting, but when you start moving, it manifests itself. So it's a pointer for that patient is most probably having inflammatory arthritis, and I think they should seek medical attention for proper diagnosis.
Okay. Maybe one more before we wrap it up. This one says, my dad is having a lot of pain due to arthritis at the back. We have tried a lot of medication, but still we have not gotten any solution. Any advice? They have tried including injection.
Yeah, back pain is a big thing. Back pain is one of those things that we can talk about. But number one, I would want them to check our website for our clinic, Nairobi Arthritis Clinic. There's a book there called Understanding Back Pain. If they can get a copy and read, they'll be able to understand where they can get help. But they should not give up. Keep on trying until that pain ends. You know, apart from injection, depending on the problem, we can have surgical intervention. We can have how they can be advised by physiotherapists to take care of their backs. Yes.
Okay. The last one of the last one. I'm Isaac. I have a condition of pain in my left elbow, and doctor gave me Nervica, I believe, pain extended to my left ear, and I lost sense of smell. What might this be?
It's difficult to say what it is, but if you can seek attention of a rheumatologist, they'll be able to figure out what is going on. It may not be just a simple pain of the elbow. Maybe it's a systemic problem, but that needs proper evaluation, diagnosis, and management. Yes.
Thank you, Professor Omondi. Your parting shot to our viewers regarding arthritis, and where can they get help before we conclude the program?
Okay, arthritis is a common problem, the leading cause of pain, the leading cause of disability, the leading cause of absenteeism from work, and the leading cause of early retirement. So when you get pain and swelling of the joint, don't suffer in silence. Go and talk to a medical person. We don't have adequate rheumatologists in the country. We have a rheumatologist in Mombasa. We have a rheumatology clinic going on at Mombasa Hospital. We have a rheumatology clinic going on at Kenyatta National Hospital, Mata Hospital, and Aga Khan Teaching and Referral Hospital in Nairobi, and at the Nairobi Hospital. We have a rheumatology clinic going on at Aga Khan Hospital in Kisumu, and the Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu, and at the Moi Teaching and Referral Hospital. And those are not enough. The doctors there are overworked, overwhelmed. But we are also training and equipping doctors with skills or to improve, both in the medical school and outside. We have what we call the Uwezo Rheumatology Initiative. We are going again to start with Homa Bay County to train the medical officers within this month on early diagnosis and treatment of arthritis. Then we'll move to Kisumu County, Siaya County, as resources arise. But we are hoping that the Council of Governors, through their health committee, will come up with the funds which can allow us to train across the country all this. But secondly, our doctors are being trained adequately in the medical schools. Let us not leave them unemployed while the hospitals are empty. They'll come and help in management of patients with arthritis. It pains me as a teacher to meet my students helpless and jobless, while the hospitals, when I go, have no doctors. Thank you.
Oh, Professor. That is, I'm trying to look for the word to say, but thank you. I believe get great people in government, in county leadership you've watched and you've had, and there's great actions there to be taken. And for the viewer watching and you have this condition, there is help for you. Professor, you can remind us again about the website that our viewers can visit to check about back pain.
The book, Understanding Back Pain, is this one.
Okay.
And you can get it from the www. Nairobi Arthritis.
Okay. Nairobi Arthritis.
Let me get you. Nairobi Arthritis at .org.
NairobiArthritis.org.
Yes.
Kindly check that up and you'll get help.
Yes.
And thank you, Professor Omondi, for gracing us. We've learned a lot, and may the Lord bless you and refresh you for the great work you're doing.
Thank you.
Helping our patients. And the Lord just refresh all of you and your fellow doctors as you serve. And may Serekali here and do something about hiring more doctors to help treat our patients suffering from arthritis. It's been a joy serving you tonight on Health Check. This is where we have to stop. My name is Grace Mutiso. Wish you a blessed night. Stand by for Chiriku coming up shortly. And thereafter, Tony Omondi joins you on Newswatch at 9 o'clock. God willing, we'll do this again next week on Tuesday. But remember to catch a repeat tomorrow, I believe, at 11 o'clock, right here at Hope TV. But you can watch it anytime on YouTube and Facebook at Hope TV Kenya. Shalom and God bless.